Manager. I joined the organisation in October 2013 and I was amazed to find that we were booking all our women through our antenatal clinic as their first appointment with the midwife. And under the recommendations of the Community Service Review that was out in 2011, we felt that we needed to re-establish where that booking took place and move all the bookings back out into community, which we did. And in January 2014, we commenced with all the first contact with midwives being out back in the community, either at the GP surgery or in the community setting. The consequence of this meant that women couldn't be booked directly onto our E3 patient information system, and it meant that we were having to use paper performers, which led on to this project. So we ended up with more paper, wasted time and duplication, because what was happening was women were being booked in the community, they were being booked on the paper performer. That was done by the midwife. The paper performer came into the unit, it would take time to get to us, and then a midwife or a healthcare assistant in antenatal clinic would then duplicate the work again by putting it back on the computer, in essence doubling the same episode of care twice. This led to inaccurate data collection, delays in getting the information in, and low compliance with reporting to Welsh Government against the maternity indicators. So the plan was to produce a business case, which we submitted in early 2014, to look at funding 85 community mobile devices. It also incorporated the use of an IT lead that would help to implement the project. This would allow us to directly book women onto the E3 system while they were out in the community, in their GP surgeries or in the community setting. The funding was finally realised in late 2015. It took a long time to get the funding agreed. The emphasis was based around looking at financial costs as opposed to, as we've heard earlier, about the quality and the process. So it did take us a long time to get it through our clinical board, but we managed it in the end and the finance was realised. And so we began the rollout programme at the beginning of 2016. This involved training of the midwives to make sure that everybody was up to speed with using the E3, but also using the mobile devices. We started with a small group of just having 5 devices out to test it and make sure that it was working for us and the things that we needed it to do. We had a lot of feedback from the midwives working with the IT lead to make sure it was fit for purpose before we then started rolling out all the devices. We're now up to 26 devices, should be by the end of this week, with a further 5 to 10 being rolled out each week after that. And we hope to have all out by the end of April. I think it's jumped. So the difference, women can be booked directly in community. The data now is being recorded more accurately. Information is instantly available in the unit, so when women come to antenatal clinic they don't have to reiterate everything that's happened to them. There's improved reporting, reduction in the use of paper, because obviously we've scrapped the paper performer, reduction in travel, the midwives not having to bring the paper performer in, and reduction in duplication and loss of time, because now the woman is just booked by the midwife and it doesn't have to be repeated by the healthcare assistant putting it on the computer system. And the future is that the mobile devices can be used for all sorts of other things as well. So they can access portal, gain blood results, view policies, send emails and use our electronic diaries, and we hope this will revolutionise how we work on community moving forward.